The following program has been furnished and paid for by Ask the Expert Show. KSEV is not responsible for its content or the products or services offered. Welcome to the Ask the Expert Show with local experts in the field of health, legal, financial, and home improvement. Now, here's your host, Gary Knight.
Well, hello, everybody. Welcome to our program, Ask the Experts. And for those of you joining us that are new to the program, welcome in. Today on the show, we're going to be joined by Felix Cannibal of Avatar Home Health Agency, Senior Care Made Available. Hi, how are you doing today, sir?
I'm doing great, Gary.
281-703-8050 is a number you'll want to call if you're interested in what we're about to say. So let's move on. For the people that are just joining us, don't know what's going on, tell us what kind of services Avatar Home Health offers.
Sure. Yeah, first of all, I'd like to say that I'm very, very grateful to all my audience. I've been getting a lot of phone calls for having such a short time. We've only been in the air for like 2 months.
You haven't told me that. That's
great.
Yeah.
We only been on the air for like 2 months. I only get to be, actually, out of the half an hour, I only get to talk for 25 minutes. And I do this only every Sunday. And a lot of people are beginning to call me, asking me questions. They need help. Actually, one lady called me. That was very funny. She says, well, Mr. Felix, I'm 84 years old, and you talk about insurance, but you didn't talk about this, and you didn't talk about that. I had to apologize. So I said, ma'am, I only got 20-some-odd minutes, and I have so much material to cover that it's impossible. I could be talking 2 hours about the services we provide and the different cases that we help with. But basically, Avatar Home Health, we started back in 2006. We started just, 2 people, the director of nursing and myself, and slowly we grew through the years. I mean, really, at the beginning, we grew real fast. Mm-hmm. And today, after, 12, 13 years in the business, we can brag about a couple of things. One of them is that we're about the only agency in the region that provides home health, hospice, and caretaker services. Most agencies either do one or the other one, or maybe they do 2, but we cover all 3 bases. So we're Medicare and Medicaid certified. We're licensed and insured. We're actually, this is another thing that we can brag about that very few other agencies have, which is we've been given the gold seal of approval by the Joint Commission. And the Joint Commission is an agency it's a national agency that Medicare has assigned to accredit, in other words, to survey, to inspect the hospitals and the health providers in the United States.
This is annual.
This is annual, but they can come anytime they want to. They have to come at least every 3 years. Especially after you're at the beginning they come, and then they come a few months later. In our case, they came in April, and then in October they showed up again. And he'd say, we're here to do a survey. And I told him, well, you just did one in April. He says, we know, but we're here again. We want to make sure that you're doing things the way that Medicare wants you to do it. So we have to work on those regulations. And only 10%, less than 10% of the agencies in Texas have received the gold seal of approval from JCAHO, or the Joint Commission, which is something that we're very, very proud of.
Very good.
To have gotten. So what services do we provide? So home health. Home health includes anything that has to do with the nurses going to your home, taking care, let's say, if you are in pain, you have a wound, you don't know, you're having problems taking the medications. You don't know what medications to take when. You don't feel right, and you go to the doctor, and the doctor says, well, you need some help at home. So that doctor's going to refer you to an agency, and when our nurses go there, they help you in all those matters. Then let's say that you have problems walking, problems with your balance, upper body strength, lower body strength. Then the physical therapy and occupational therapy can get involved. Let's say that you had a stroke, so you're having difficulty speaking or difficulties swallowing. So we get a speech therapist involved. Let's say you get you got problems, just doing your linen. You cannot do your bed. You cannot take a bath by yourself. It's not safe. So then we get a home health involved. So whatever you need at home, we can help you. That's under the home health services. Then we have the hospice services. Hospice services are for those who's got a terminal illness and the doctors and the family and the patient have decided that there's no use to keep fighting it, that, they're in too much pain. There's nothing else that's going to help them. They're going through everything. In the case of cancer, let's say they're going through radiation. They're going through chemo, radiation, surgery, and the cancer keeps coming back, and they're just tired of fighting it, and just say, okay, so I don't want to go through all this. I don't want to go through all this pain, and I want to enjoy the last few months of my life with my family, getting all my affairs in order, and just being with my family. But I don't want to be in pain. I don't want to be going from doctor to doctor, and I'm fine. And we have many patients that tell us, Mr. Felix, I had a wonderful life, and I don't want to do this to myself, not to my family. I don't want to keep suffering, and I don't want to keep my family going through what they're going through by taking care of me. And so that's what hospice is about. We send nurses and we send doctors. We do everything at the patient's home so the patient is as comfortable as possible, free of pain. We provide everything. We provide the nursing, the doctors, the counseling, the chaplain, the medical equipment, the medical supplies, the medications. We supply everything at the patient's home, and that way the patient doesn't have, and the patient's family doesn't have to be going out and running all over town to get what the patient needs. Of course, there's more services included on that. I'm trying to keep it short here for the sake of time.
Okay.
Then we have the caretaker or providers department. In that department, we have people that they're not nurses nor nurses assistants. These are people that go to the patient's home and just help with the everyday activities. Say the patient needs somebody to go shopping for them at the grocery store, the pharmacy. They need somebody to do light cleaning in the house, maybe prepare some meals, help them with the bath, again, the linen, clean the kitchen, clean the bathroom. So this person goes there and they spend 2, 3, 4 hours, depending on how much the insurance or the state is willing to pay for or tell us, depending on the necessity of the patient, the state, Medicaid, or the insurance company is going to tell us, okay, go 3 times a week, 2 hours a day, or go 3 hours, a day for 7 days a week. They decide on that, and we provide that person to help the patient. So to summarize, so that's the home health, the hospice, and the provider services. Those are the services that we provide. And if you need help, if you live alone, if you're over the age of 65, or even if you're not, but you feel sick, you're in pain, you're uncomfortable, you need help, you actually do not know how to get help, please call me. Talk to me. I'll get some information from you, and then in a matter of minutes, I can come back to you and say, okay, these are the services you can get free of charge. And that way we can plan a way to help you. And it's not going to cost you anything. The only thing that's going to cost you is a phone call. So please call me. I'll give you my personal cell phone. And I only have one phone. And another point that I brag about is that even though we help over 360 patients, every single one of those families have my personal cell number, which is 281-703-8050. That is 281-703-8050. So call me. Leave me a message. If I don't answer, just leave me a message. I'll call you within half an hour or so. That's the same number that my wife, my daughter, my grandkids call me on. I don't have 2 or 3 telephones and say, oh, after 5 o'clock, I'm not going to answer my phone. I answer my phone 24 hours a day. So please, there's no other agency that the owner of the agency is going to tell you that.
281-703-8050 is the number to call. That's your
Right.
personal number. Now, can they qualify? Can they call and ask, how do I qualify? Is that number the same
Oh,
number?
of course, yeah. You call me, and this again, it's just a matter of minutes. So when we come back after the break, I'll go into details in a couple of other things, and also talk about a new word in our dictionary, in the medical dictionary, which is not new, but it's palliative care. We're going to talk a little bit about palliative care.
Do you or anyone you know need help with your daily activities, grocery shopping, bathing, cleaning, cooking? If you do, Avatar Home Health and Hospice can help you. Avatar Home Health can also help if you need nursing services and or therapy services in the convenience of your home. If you live in Harris or Montgomery County, in most cases, they can start services within 24 hours of your calling them. Avatar Home Health and Hospice was established in 2006. Avatar Home Health and Hospice is not only Medicare and Medicaid certified and licensed and insured, but is one of the few agencies that has received the Gold Seal from the Joint Commission. This accreditation has only been granted to less than 9% of the agencies in Texas. At this time, Avatar Home Health and Hospice takes care of over 340 patients. Whether it's home health, hospice, or caretaker services, one of their 220 professionals will be assigned to help you. Avatar Home Health accepts Medicare, Medicaid, United Healthcare, Aetna, Molina, Humana PPO, and other insurance companies. They also accept private pay patients. They can also help you find what benefits you qualify for. Most of their services are paid by Medicare, Medicaid, or your insurance company most of the time, without any out-of-pocket expense to you. Call Avatar Home Health and Hospice at 281-703-8050. That's 281-703-8050. Or email them at info@avatarhomehealth.com.
And that's the same number we've been talking about for most of the show.
Right.
281-703-8050. I'm doing this by my memory.
That's great.
Because we've said it so many times, and I hope you learn that number or write it down. 281-703-8050 is the number to call if you want some more information about the services that Avatar Home Health has for you. Why don't more people get home health or hospice?
Well, there's several reasons, but one of them is the lack of knowledge. A lot of people do not really know what home health is all about. They think that in order to get home health, they have to be bedbound. In other words, they have to be in bed and not able to do anything. If not, they think that they cannot get home health. They don't deserve it or they don't need it. The other reason is that people think that it's going to cost them money. And they say, well, no, I don't have money. I can hardly buy my medicine, so how can I have a nurse come to my house? That's another reason.
Understandable. Yep.
Right. And then other people say, well, I don't want to use up my benefits now because there's a limit. I don't want to run out of those benefits because when I need them, I might not have them. So to begin with, these services are free. If you have Medicare, or say one of these Advantage plans of Medicare substitution plans, it's not going to cost you anything. An agency, a home health agency, is going to bill Medicare or the insurance company. If they don't pay for any reason, it's illegal to come to the client and say, well, Mr. Patient, the insurance company didn't pay me, so now you got to pay me. Or they only pay me so much, now you owe me $500. Wow. That is not the case. If you're a Medicare patient or Medicare qualified, it's not going to cost you a penny. So why not get the services? You do not have to be in bed, bedbound, in other words. The only thing that you need to be is what is called homebound. Now, that word confuses a lot of people, even doctors. I have doctors that tell me, well, My patient comes to my office every other week to get chemotherapy, so that person is not homebound. No, that person could be homebound. What homebound means is that person has a lot of difficulties to go out of her house, but that person can still be driving. They can still drive to the church, to do grocery shopping. The qualifying thing is that it's got to be very difficult for them to do it. But they can go to church, they can drive themselves to church, to the doctor, to those things that are very needed, that the person really needs. So do not do this on your own. Get somebody to help you do this, and I can help you. Call me and tell me, Mr. Felix, do you think that I qualify for home health? I will get some information from you. We'll get in touch with your doctor, and then I can come back to you and say, yes, you qualified, or not, you do not qualify. It's not going to cost you anything. And by the way, I'm glad I mentioned that we need to talk to a doctor, because everything that we do is on the doctor's orders. In other words, I cannot say, okay, this is what we're going to do, or our nurses are going to say, well, this is what we're going to do. Uh-huh. No, we suggest a plan of care to the doctor. The doctor reviews it, and he's going to either change it, approve it, or not. But we're going to do what your doctor wants us to do. So you're in good hands. It's not, this is done by people who really, really know what they're doing. As far as cost, it's not going to cost you anything. So why not take advantage of it? If you've been paying Medicare every time, since 1934, I think it started, or actually 64, I'm sorry. Every time you got a paycheck, the government took a little bit of it, and your employer paid towards it too. So every week you've been paying for this for every paycheck. So now that you're 65 or you're disabled, why not take advantage of those benefits? You already paid for them.
They're yours.
So why not? Exactly, they're yours. So take advantage of them. As far as running out of them, you're never going to run out of them. Now, nobody wants to abuse those services because it's not the right thing to do. It's not ethical. It's not moral. It's not honest. But if you need the help, get it. And this help doesn't have to be for the rest of your life. It could be for 2 weeks. It could be for a couple of months. Some people are coming to home health. They get home health for a week, 2 weeks, a month, month and a half, or a year. It all depends on your conditions. How are you improving? Are you able to do things by yourself? Some people have difficulties. Once as they start getting physical therapy and occupational therapy, that they start taking the right medications at the right times, and they learn how to do this, they start feeling better. And when they start feeling better, we give them our business card and say, here, call us when you need us, and we leave. We discharge them, and we're there for them when they need us, but we don't have to be there anymore because they're getting along fine. If you're not getting better and you still need the help, well, we'll still be there with you, for you. So just make that phone call. Don't do it on your own. Let people who've been training this help you. And by the way, and there's no limits. You're not going to run out of it. Say, well, I had 2 years of home health. Now when I need them, they're not going to come. It doesn't work that way. The way it's set up is a service that you're going to get when you need it. When you don't need it, it's stopped. When you need it again, it starts again.
So you're mentioning the services. How do you know if you're getting the services you're supposed to get?
Well, that's difficult for the patient to know. However, when the agency goes out there, they're going to tell you what they're going to do for you. Normally, the services are going to include the services of a nurse and a therapist, or not, but at least a nurse. So you're going to have a nurse go there. Now, how do you know as the patient whether the nurse should be there 1 time a week, 3 times a week, 5 times a week? How do you know that? So basically, if you feel that at times that they come one day and then, let's say 2-3 days later, you still not feeling well, or you need some help with the wound, or with, you have pain or something, call the agency and tell them, look, I really would like the nurse to come more often. And the agency needs to listen to you, consult the doctor. And if the patient says, I need more help, and the doctor says, yes, give him more help, the agency should do it.
Does it make a difference which agency they choose?
Of course. It makes a difference. On paper, all the agencies should do the same.
Okay.
But that's like going down, down to a grocery store, and you're going to see that in some places, services are much, even if you go to the same, let's say you're going to HEB, one HEB could have much better services than the other place, than the other HEB down the street, just because people there, are trained different. So the same thing happens, or they have a different attitude. So the same thing happens with an agency. We're not about the money, even though, yes, we're in business to make money, but we put the patient first. And we know, and we've been doing this for like 13 years now, 12, 13 years. So we know that if we do the right thing, if we take care of that patient, if that patient does well or feels better because we're providing them with the right service, we know that they're going to tell the doctor, says, oh, this agency, Avatar Home Health, is the best. Oh, they're nurses. And these are words out of my patient's mouth.
We have regular testimonies we've talked about over the past few programs.
And the ones that I love is that in more than one occasions, our patients have said that nurse, either her name is Gloria or Maria or Jennifer, she's not a nurse. She's an angel. So when I hear those words, I bring tears to my eyes, because that's how happy I am that our patients are that happy with our services. So yes, it matters a lot what agency you choose. Now,
who chooses the agency?
That's good. Let's say you go in the hospital, right?
Okay.
The hospital, under Medicare guidelines, they're supposed to give you a list of agencies that provide services in your zip code.
Okay.
Now, do they do that? I don't want to make any enemies out there with the hospitals or their caseworkers, but let's say, like, I won't make any comments about that. But I do know one thing: you can tell the case manager at the hospital or your nurse at the hospital, says, "Hey, if you're gonna write a prescription or an order for home health, I want Avatar Home Health." You can tell them that you want Avatar Home Health. That way, you know that you're going to get the services that you need. You know that you're going to get the services from people that care. You know that you're going to have a phone number. That is my phone number, which is 281-703-8050. You're going to have that number to call me if you need anything.
Talking about services, what can you do? Some people are going to be probably unhappy with some of the services, so what can they do about it?
Of course. And sometimes, believe me, sometimes it's not that the nurse is doing anything wrong or something. Sometimes it's just a misunderstanding. But if you're not happy with your services, what you should do is you should call your agency and tell the agency, I don't like what the nurse is doing. I don't like the way she talks to me, or whatever. Whatever the problem is, tell them they need to fix it. If they don't fix the problem, you have the right, once again, you have the right to go to any agency that you want. In the area of Houston, there's over 800 home health agencies.
Wow.
Yeah, there's a lot of us out there. So take advantage of that. If you don't like agency ABC, call Avatar. Call me. I said, Mr. Felix, and it happens. It does happen a lot. Said, Mr. Felix, I've been with this agency for 2 months. I don't see the nurse. She came the first time, and I haven't seen her in 2-3 weeks. Well, that agency is not doing their job right. So change. They're getting paid. So why not take advantage of it? Just change and call me at 281-703-8050.
And you can do that in just a few minutes because he's walk out the studio. Right?
Exactly. Do that. Call me now. I'm going to be off the air in a few seconds, and I'll be ready to talk to you. So please call me at 281-703-8050.
That's Avatar Home Health Agency. Thanks again, as usual, Felix. Mr. Felix. We'll see you soon.
Thank you, Gary. See you next Sunday.
Yes, sir. Stay cool. Have yourself a great day. Ask the experts. We'll see you again next week for another program on AM 700 KSEV, the voice of Texas.
Thanks again for tuning in for another Ask the Expert show right here on AM 700 KSEV.